Last October, I came closer to losing my own father than I have ever come to losing anyone. Not because of a rare diagnosis, not because of a missed test or a delayed treatment, because of something I never even thought to warn him about. I have been a cardiologist for more than 2 decades. I have studied aging patterns in over 14,000 patients. I have performed thousands of cardiac procedures and published research that my colleagues read at conferences. I have spent my entire professional life learning how to keep hearts beating. And I still almost lost my father. He called me on a Tuesday morning just before 7:30. I can still recall the quality of the light through the kitchen window. I was sitting at my kitchen table going through patient notes before heading into the office. "Son," he said, and his voice carried something in it I had never heard before, a tightness, a kind of strain that did not belong there. "I feel dizzy. My chest feels strange. Something is not right. I want you to understand who my father is. He was not someone who called to complain. He was raised in a generation that endured things quietly. He was not the type to reach for the phone unless something had pushed him well past his threshold for discomfort. That alone should have told me something. And what did I do? I, Dr. David Mercer, cardiologist, the person he was calling precisely because I was supposed to know these things, told him it was probably nothing. I told him his body was just waking up. I told him to sit down, drink a glass of water, breathe slowly, and give it a few minutes. I said it would pass. I said it with total confidence. 46 minutes later, my mother was screaming into the phone. I was still at the kitchen table. My father had collapsed in the kitchen. His lips were blue. She could not find a pulse. The ambulance arrived in under 7 minutes. The paramedics worked on him for 12 minutes before they restored a stable rhythm. 12 minutes of compressions. 12 minutes of chest shocks. 12 minutes during which my father's brain went without the oxygen it had been receiving every moment of every day for 68 years. When you are a cardiologist and someone tells you your father's heart stopped for 12 minutes, every statistic you have ever memorized becomes personal. Every worst-case scenario you have ever studied suddenly has a face you recognize. I met them at the hospital. I stood in the corridor in my white coat with every credential I had ever earned and watched the emergency team fight to bring him back. I was a spectator during the most important moment of my professional life, and I was completely helpless. After they stabilized him, the emergency physician who had been in that room with me for years pulled me aside. The look on his face was the kind doctors use when they are about to deliver a truth that cannot be softened. He asked me one question. "What was your father doing this morning before the symptoms started?" I did not know. I called my mother. She was still shaking, but she walked me through his morning with the precision of someone who had watched the same sequence unfold every single day for months. "Nothing unusual," she said. "Just his routine. The same thing he has done every morning since he retired 8 months ago." And that was the moment everything landed. His routine was not the problem. The timing of that routine was the problem. It had been quietly building pressure inside his cardiovascular system every single morning, and that morning it finally gave way. Before I go any further, I want you to do something. Leave a comment right now and tell me exactly what you do in the first 10 minutes after you wake up. Not what you think you should do. What you actually do. Be honest with yourself, because what I am about to share with you will only matter if you are willing to look clearly at your own morning habits. My father survived. After 3 days in the intensive care unit and 2 weeks of careful recovery, he finally came home. I drove him myself. We did not talk much on that drive. There was not much to say that the silence was not already saying. But he is not the same man who walked into that kitchen that morning. He now lives with the knowledge that his heart stopped, that medically speaking, he was without a pulse for 12 minutes, while paramedics worked to restart an engine that had been beating without interruption for 68 years. And the thing that still keeps me awake, the part that I cannot make peace with, is that it was entirely preventable. Since that morning, I have done something I had never done before in 20 years of cardiology. I became obsessed with the window of time between waking and the first hour of the day. I started keeping a notebook beside my desk at the clinic. Every patient who mentioned a morning event, every study reference that crossed my path, every detail that seemed connected to timing. I wrote it down. I interviewed more than 180 patients who had survived sudden morning cardiac events. I reviewed every piece of research I could find on circadian cardiology, chronobiology, and cardiovascular timing. I pulled data that most cardiologists never examine because we are trained to treat disease once it arrives, not to understand the rhythms that make it more likely to arrive at a specific time of day. What I found changed the way I practice medicine and changed the way I live my own mornings. There are 5 specific habits that millions of people perform every single morning without question. Habits that look completely harmless from the outside, but that, during the first hour after waking, when your cardiovascular system is already operating under maximum physiological stress, can stop a heart. My father was making one of these 5 mistakes every day for 8 months, and based on what I have learned from hundreds of patient conversations since then, there is a meaningful chance that you are making at least one of them. If you are over 60, or someone you love is over 60, subscribe to this channel right now. I am going to spend the rest of this video sharing information that might prevent someone you care about from becoming another morning cardiac statistic. You may plan to come back later. You will not. Subscribe now and make sure this reaches the people who need it. Now let me explain what is happening inside your body the moment you open your eyes each morning, because once you understand this, everything else I am about to share will make complete sense. Your body does not gradually switch on. It does not ease into the day the way a dimmer switch slowly brightens a room. It accelerates from stillness into a state of significant physiological intensity within minutes, and that acceleration places enormous demand on a cardiovascular system that was, just moments ago, in a state of deep rest. First, your circadian rhythm triggers a substantial release of cortisol, your body's primary stress hormone. Within 15 minutes of waking, cortisol levels can rise by 50 to 60%. This is not a gentle nudge. This is your body pressing hard on the accelerator, pushing heart rate upward and tightening blood vessels simultaneously. Second, your autonomic nervous system shifts rapidly from the parasympathetic state, rest and recovery, into the sympathetic state, which your body treats as alert and ready for threat. Adrenaline floods the bloodstream. Blood pressure climbs by 10 to 20 points within minutes, sometimes more. Third, after 7 or 8 hours without drinking anything, your body is in a state of meaningful dehydration. Your blood has become thicker and more viscous. Your heart must work considerably harder to push that denser blood through your vessels. Now picture a heart that has been beating without pause for 60, 70, or 80 years, facing this storm every single morning. Arteries that have naturally become less elastic. Blood vessels that respond more slowly to pressure changes. A cardiovascular system with decades of accumulated wear. And then picture someone adding morning habits that make this storm worse. That is what my father was doing. That is what millions of people do every morning without any awareness of the risk. The first dangerous habit is something approximately 87% of people do without a second thought. Getting out of bed the moment the alarm goes off. The alarm sounds, the eyes open, and immediately, as if answering an urgent signal, people swing their legs over the side of the bed and stand up before any other thought has fully formed. It feels efficient. It feels disciplined. For people over 60, however, this single movement can trigger a condition called orthostatic hypotension, a sudden and potentially dangerous drop in blood pressure that can cause dizziness, falls, fainting, and in serious cases, life-threatening cardiac arrhythmias. Here's the mechanism. After lying flat for 8 hours, blood is distributed relatively evenly throughout the body because gravity is not pulling it in any particular direction. The moment you stand up quickly, gravity immediately draws approximately 1 full liter of blood downward into the veins of your legs and abdomen. 1 liter, redistributed in seconds. Suddenly, your heart has significantly less blood available to pump toward your brain. And your brain, unlike muscle tissue, cannot store oxygen. Every second of reduced blood flow begins to matter. In younger people, specialized pressure sensors called baroreceptors detect this drop almost instantly and signal the heart to compensate before you even notice anything. But with age, these sensors become slower and less responsive. There is a delay between the pressure drop and the compensatory response. During that delay, your brain receives less oxygen than it needs. Dizziness follows, then blurred vision, weakness in the legs, and in the most serious cases, loss of consciousness, and a fall. Falls are among the leading causes of death in older adults. Hip fractures, head injuries, internal bleeding. Many of these occur during the first minutes after rising from bed. But the danger does not end with the fall. Once your body finally registers what has happened and triggers its correction, it overreacts. It releases a surge of adrenaline to force blood pressure back up rapidly. Your heart goes from struggling to pump to suddenly pushing against dramatically increased resistance. This triggers reflex tachycardia, your heart accelerating from near stillness to high speed in moments, like an engine revved from idle to maximum RPM without any transition. That sudden violent shift can trigger fatal arrhythmias in a heart already under the strain of the morning hormonal surge. The solution is disarmingly simple, and it costs you nothing except 2 minutes of patience. When the alarm sounds, stay in bed for 30 to 60 seconds. Take 5 slow, full breaths. Then sit up gradually and rest on the edge of the bed with both feet flat on the floor for another 60 seconds. Move your ankles in slow circles to activate the calf muscles that help push blood back toward your heart. Only then stand up, and do so slowly. Those 2 extra minutes can be the difference between an ordinary morning and an ambulance at your door. The second dangerous habit is one that almost no one considers a risk: not drinking water first thing after waking. Most people's first impulse is coffee, the bathroom, or their phone. What they do not register is that their body has been losing fluid continuously for 8 hours through breathing and perspiration alone. By the time you open your eyes, you are already dehydrated. This produces a state called hemoconcentration. The total volume of your blood decreases while the number of cells and platelets it contains remains the same. The result is blood that is thicker, stickier, and considerably more prone to clotting. Think of your heart trying to push honey through narrow pipes rather than water. The workload increases substantially at the exact moment when cortisol and adrenaline are already placing maximum demand on the system. Thick blood is not only harder to pump, it is also far more likely to form the clots responsible for heart attacks and strokes. When platelets become stickier, they cluster more easily. If there is any instability in the plaque lining your coronary arteries, those platelets will accumulate rapidly at that site, forming a clot that grows until it blocks the artery entirely. This is how most heart attacks happen. It is not a coincidence that the majority occur between 6 in the morning and noon, when blood viscosity is at its highest. The risk of a heart attack is approximately 40% higher in the morning than at any other time of day. The risk of stroke is nearly 49% higher during those hours. Thick morning blood, combined with elevated cortisol and surging adrenaline and rising blood pressure, creates a physiological environment where the margin for error becomes dangerously small. The solution is genuinely simple, and I want you to begin it tonight rather than waiting until you feel like it. Before going to bed this evening, place a glass of water on your nightstand. Make drinking 300 to 400 milliliters of room temperature water your absolute first action after waking, before your phone, before the bathroom, before coffee. Within minutes of drinking it, you begin diluting your blood, reducing its viscosity, and lightening the load on your heart. You are literally reducing the danger in the first minutes of the day. The third habit is one that nearly 80% of people consider essential to functioning: drinking strong coffee on a completely empty stomach immediately after waking. I drink coffee every morning. I am not telling you to stop drinking it. I am telling you that when and how you drink, it can mean the difference between a habit and a hazard. And that distinction becomes more important with every passing year after 60. Caffeine is a potent stimulant. It triggers your adrenal glands to release additional adrenaline. It accelerates your heart rate, constricts your blood vessels, and raises your blood pressure rapidly. Now recall what is already happening. Cortisol is elevated. Blood is thicker than normal. The cardiovascular system is already managing the transition from sleep to wakefulness. Adding a heavy dose of caffeine to that environment is like adding fuel to a fire that is already burning intensely. For younger adults with flexible arteries and healthy hearts, the body may absorb this extra stress without incident. For someone whose cardiovascular system has been working without interruption for 6, 7, or 8 decades, and who may have undiagnosed coronary artery disease, this combination can trigger dangerous arrhythmias, hypertensive crises, or a cardiac event. When coffee is consumed on an empty stomach, caffeine is absorbed far more rapidly. Without food to slow its passage, peak caffeine levels in the blood are reached in 15 to 20 minutes rather than the 30 to 60 minutes it takes after a meal. Blood pressure may spike by 20 to 40 points within minutes. Heart rate can climb to levels that in a stressed cardiovascular system create genuine instability. I have reviewed case histories of patients who suffered heart attacks within 30 minutes of drinking strong coffee on an empty stomach. The coffee was not the underlying disease. It was the trigger that caused a vulnerable plaque to rupture and form the clot that proved fatal. My father did not drink coffee, so this was not his particular risk. But it appeared consistently in the histories of dozens of patients I spoke with after they survived morning cardiac events. If you cannot start your day without coffee, eat something first, even something small. A banana, a handful of nuts, a slice of toast, anything that slows caffeine absorption and prevents the sudden spike. Drink water before coffee, always. And if you currently drink 3 cups before mid-morning, consider reducing that over time. The fourth habit is one that many people genuinely believe is doing them good. Performing intense exercise during the first hour or two after waking, running, weight training, high-intensity interval work, demanding fitness classes. Let me be clear. Exercise is one of the most protective things a person can do for cardiovascular health. I am not suggesting you stop. I am saying that timing matters profoundly, especially after 60. During the early morning hours, the cardiovascular system is already managing elevated cortisol, surging adrenaline, thickened blood, naturally higher blood pressure, and blood vessels that have not yet fully adapted to the demands of the day. Adding intense exercise at this moment asks a system that is already working near its limit to shift into a higher gear without any transition. The demand for oxygen rises sharply. If there is any degree of silent coronary artery disease, which is far more common in adults over 60 than most people realize, that demand may outpace the heart's ability to supply it. Myocardial ischemia follows, and with it, the conditions for dangerous arrhythmias. The situation becomes significantly worse when people exercise in a fasted and dehydrated state, going directly from bed to intense physical exertion without eating or drinking anything. Fasted exercise forces the body to break down muscle tissue for energy and releases additional cortisol, adding more physiological pressure to an already stressed system. Blood sugar instability places further strain on both heart and brain, narrowing the margin of safety at the exact moment when the body can least afford it. Thick, dehydrated blood struggles to transport oxygen efficiently. The result is a convergence of risk factors that has contributed to sudden cardiac events in people who appeared completely healthy and believed they were making responsible choices for their bodies. If you prefer exercising in the morning and your schedule makes that the most practical option, wait at least 2 to 3 hours after waking before beginning any session. Drink water first. Eat a light meal to stabilize blood sugar and provide available energy. Begin every session with a gradual warm-up that lasts longer than you think is necessary. Whenever your schedule allows, shift your most demanding sessions to mid-morning, afternoon, or early evening, when your cardiovascular system is more stable and better positioned to handle physical stress safely. Now we come to the fifth mistake, the one that stopped my father's heart. Before I tell you what it is, I want to ask you something. If what you have heard so far has given you a new way of seeing your own mornings, if you can see how habits that appear harmless can accumulate into serious risk during the most physiologically demanding hour of the day, press the like button right now. I have spent months researching, interviewing patients, and putting this content together because I do not want what happened to my father to happen to yours. The algorithm decides whether this video reaches the people who need it based on engagement. A like takes 1 second. It might mean that someone else's father gets a warning my father never received. The fifth and final mistake is one that wellness communities and health influencers have actively promoted in recent years as a tool for longevity. More energy, better focus, stronger immune response, reduced inflammation. It appeared to have science behind it. My father read about it. He watched videos about it. He believed in it completely and practiced it faithfully every single morning for 8 months. Taking an ice-cold shower or exposing yourself to extreme cold immediately after waking up. Every morning, my father got out of bed, walked to the bathroom, turned the shower to its coldest setting, and stood beneath the water for 2 full minutes. He breathed through the initial shock the way the videos instructed. He counted his breaths. He believed every second of that cold was building his resilience and extending his life. On the morning he collapsed, he followed the same routine. He woke up, walked to the bathroom, turned the water to maximum cold, and the instant that freezing water hit his chest, his cardiovascular system failed. His heart stopped. Here is the physiology of what happened. When the body is suddenly exposed to extreme cold, especially cold water against the chest and torso, it registers the experience as an immediate life-threatening emergency. Every survival mechanism available activates at once. Within seconds, massive peripheral vasoconstriction occurs. Thousands of tiny blood vessels in the skin and extremities constrict almost simultaneously, like thousands of valves slamming shut at the same instant. All of the blood that had been flowing through those vessels suddenly has nowhere to go. Pressure inside the remaining open vessels rises explosively. Research has shown that cold water immersion can increase systolic blood pressure by 20 to 40 points within seconds. For individuals with existing hypertension or compromised cardiovascular function, the increases can be far greater, with documented spikes of 50 to 60 points in some studies. For a heart that has been working continuously for decades, for arteries that have lost much of their natural elasticity, this kind of sudden pressure increase is not something the system can absorb safely. The risk of rupture in an unstable coronary plaque becomes real. If that rupture occurs, a heart attack follows within minutes. If it occurs in a weakened vessel in the brain, a hemorrhagic stroke is the result. But the cold shock does not only raise blood pressure, it simultaneously forces the heart to pump with extraordinary effort against the enormous resistance created by thousands of constricted vessels. The heart's demand for oxygen escalates sharply. If the coronary arteries cannot deliver enough oxygen-rich blood to meet that demand, which is a common situation in adults over 60 with undetected coronary artery disease, the result is severe oxygen deprivation in the heart muscle itself. In that deprived state, the heart's electrical system becomes unstable. Rather than contracting in a coordinated rhythm, the muscle begins to quiver chaotically. No blood reaches the brain, no blood reaches the body. This is ventricular fibrillation. This is cardiac arrest. And unless it is reversed within minutes with a defibrillator, it ends a life. My father was lucky. He had a wife at home who called immediately. He had paramedics who arrived quickly. He had 12 minutes of intervention that brought him back. Most people are not that lucky. Most people do not have someone standing nearby, and many do not have 12 minutes. The information in this video is not here to frighten you, and I want to be clear about that. Fear is not what changes behavior. Understanding does. It is here because you deserve to understand what is happening inside your body during the first hour of every day, and because the adjustments required to reduce that risk are small, practical, and within reach starting tomorrow morning. 5 habits that can be changed with relatively small adjustments to a morning routine that most people could shift without any significant disruption to their day. 5 risks that do not have to remain risks. If someone in your life needs to hear this, if you are thinking of a specific person right now, share this video with them today. It takes less than a minute, and it may matter more than you realize. Subscribe to this channel if you have not already, and leave a comment telling me which of these 5 habits resonated most with where you are right now. I read every one. I mean that. Take care of your mornings. They matter more than most people have ever been told, and now you are one of the people who knows.